Today I'm doing PDO threads for a neck lift. PDO stands for Polydioxanone, which is the same material surgeons use in the OR, and they dissolve on their own. So these are going to dissolve over the course of about a year, but while the PDOs are in our patient's neck skin, it's going to make her make collagen. So first we're going to reposition her skin with them, and then over the next year she's going to make collagen the entire time, which is fantastic. So I've already drawn on her where I want my PDOs to go, and I've already done some lidocaine injection spots, so that way when I make my channel for the PDOs, she doesn't feel it. So we'll just ensure that that's the case. Can you feel it here? Okay, good. Good answer. All right, so we're gonna make a little channel. Awesome. And there's all sorts of different types of PDO threads. The ones I'm using are barbed, so that way they give lift. There we go, right into that spot. Here we are, going right along that jawline. You okay? Yep. The answer is yes. Yes, I'm great. I love this so much. Everybody loves this on Pronux, right? I love Pronux. Okay, I'm gonna go down a little farther. Here we go. You can kind of see the course of the thread. It ends right there. I'm coming out again. And really, there's no limit as to how many threads you can put in. I love PDO threads. It's great. You can put them anywhere in the skin. So I have some in my abdomen because I had twins and it helped to lift up the skin there. You can do it in the inner thighs. If you have laxity there, you can put them over the top of the knees if there's some knee laxity. I mean, there's not a lot of things that can treat the knee laxity. So having PDO threads that we just pull up is fantastic. Okay, so we're gonna keep going. And go into this channel. You okay? Okay, got this. Okay, good girl. Doing great. And they're antimicrobial. I don't really want her to be jumping in a mud bath though for the next couple days because they're where the opening is, we just need to give it a little time to heal. So no swimming or, you know, in a lake or in a river. Not that we're going to be swimming at this time of the year, but maybe you're watching this video in the summer, so you totally understand what I'm saying. Don't let your dog lick you on these spots. Tonight, I'd love you to take your pillowcase and get a new one. So that way we know it's nice and clean. But the channels really do close up pretty quick. But why not help prevent any kind of issues by doing little things like what I just talked about. Okay. On average, I like to do about 10 threads per side. Sometimes we need a little bit more. Typically don't need less. Got this. You doing okay? Yeah, the answer is yes. Good. Right answer. Just using a little 18 gauge to make my channel. The threads I'm using are 21 gauge. I don't like using bigger gauges in the neck because the neck has thin skin, so go right on. You got this. Last one. Great. That's it. So now what I'm going to do is I'm just going to pull on them. To pull up. You okay? Mm-hmm. Yeah, you don't need that anymore. Unless you hate this part. Sometimes people do hate this part. And so the other things I would recommend afterwards is I don't want you pretending like you're Jessica Biels and doing any kind of flash dance, whiplash action with your neck. I don't want you running, doing anything that's really aerobic, where you're jumping, because I want these threads to really get surrounded by your tissue. And if you're constantly jumping, then that's not gonna work. So now I'm just going to cut some of the ends off because she doesn't want to walk around with all these threads coming out. So we're just using some sterile scissors. cutting right at the edge. And then what I'm gonna do is gonna push her skin right over the entry, and nobody will know what she's done. So it's great because it's really a no downtime type procedure. So I'm gonna work on the bottom ones for a couple minutes, but that is essentially a full PDO neck lift. So if you wanna find out if that's right for you, follow us on Instagram, Facebook, subscribe to YouTube, or just come see us at RejuvenationMD.